Hi, I'd like to talk to you about human growth hormone. It's an amino acid that's secreted by the pituitary located in the center of your brain. It peaks in adolescence and begins to drop off as we hit our 30s, 40s, 50s, 60s, 70s. Human growth hormone is a crucial hormone in that it should not be called growth hormone. It should really be called the restorative and rejuvenation hormone. Human growth hormone is responsible for everything from our skin tone, to our blood vessel health, to our lean body mass, to our psychological well-being. It's a very important molecule. Now, we hear about this all the time on the news, and we see examples of athletes abusing substances like this. What I want to clarify is, human growth hormone is a bioidentical hormone. This is not something that is strange to your body. Human growth hormone is something that has been in our bodies ever since we were formed. And what's interesting is that when we see on the news these controversial athletes where they're being accused of utilizing a substance like human growth hormone, I can tell you that somebody can inject it 1, 2, 3, 5, 10 times and actually have very little effect because it's something that's very subtle and takes a long time to see the effect. In other words, as long as you've been declining in growth hormone, replacing it reverses some of the signs, but it doesn't really maximize athletic performance. So I really do feel that human growth hormone has been over-stigmatized in the media and has been a scapegoat for what people are really using, which are synthetic steroids. Human growth hormone is not a steroid. It is just an amino acids. It's a peptide made up of amino acids. It is not a steroid, and it's been over-stigmatized because of that reason, because I believe that it's much easier to say maybe you were using human growth hormone, which is a natural bioidentical hormone, than a synthetic steroid. Now, that being said, in our practice here, what I like to do is I measure everybody's level of growth hormone via a molecule known as IGF-1, insulin-like growth factor 1. Now, what can happen is that there are healthy, appropriate zones for this molecule. For example, the optimal zone for a 40-year-old man, the top, is 255. Tops for an 80-year-old is 157. So, if you happen to be 40 and your growth hormone level is 100, well then we have a discussion that, well, you're not tops for an 88-year-old. In fact, you're in the lower end and you're nearing the low end for a 40-year-old. So there's actually a delicate way by which you can assess, do we need to even think about replacement? We have a couple of options. You have the injectable form of human growth hormone, and recently there's actually a new product that I've been utilizing called secretropin, which has some clinical studies whereby it's a sublingual spray, and it actually does make your own body make its own growth hormone, so it's known as a secretagogue. In other words, it provides the molecules necessary for your body to make its own. So people can actually utilize, depending on what situation they're in, depending on how low the levels are, they can actually utilize a secretagogue to augment their own growth hormone production, or they can utilize human growth hormone as an injectable, and now they have beautiful delivery systems, make it very easy, as an injectable that actually allows you to increase your growth hormone levels. Now, in my practice, what happens is I do not like to push the envelope. In other words, if you're 40 and tops for a 40-year-old man is 255 and you're 120, let's say, what I'll say is let's see how you are at 200. Let's see how you are at 190. Let's see how you are at 210. That's a very different approach to some of the anti-aging doctors that will push the envelope of human growth hormone from what I'm saying is 250 for a 40-year-old to 350, which is more of a 19-year-old level. So I don't necessarily believe that it's healthy to push a 40-year-old body to that of a 19-year-old level. Although there is debate in that area, I just would rather be safe. And what we're looking at is actually the medical replacement of human growth hormone for what is known as adult growth hormone deficiency syndrome. It is the only way that I can give growth hormone is by actually documenting and showing that you as an individual have adult growth hormone deficiency syndrome. And by doing so, we can then replace it and monitor a whole host of parameters. in terms of your lean body mass, in terms of your cholesterol, in terms of your lipid profiling, in terms of cardiovascular risk, in terms of your psychological, emotional well-being, in terms of your muscle mass, in terms of muscle wasting. So these are things that we would monitor. So just to be clear that when you hear about human growth hormone, this is not a panacea for everybody. You need to be low in order to have a benefit from it. Certainly if you took enough you would have a benefit, but it's economically not feasible because growth hormone is still a relatively very expensive therapy. So basically, in my practice, I like to measure and assess as part of my hormonal workup for everybody what is your growth hormone level, and basically take it from there. Now, an interesting note, when you might think, well, what makes it go down? Well, age makes it go down for sure. If you're not sleeping, you make it go down, because what happens is you secrete it at night 2 hours after you go to bed in deep sleep. So if you're not getting into deep sleep, if you have sleep apnea, if you have insomnia, then you're not secreting it. Okay. Next, if you've had any kind of a head injury, so if you've fallen and hit in your head, if you fell off a bicycle, if you were in a car accident, if you hit a windshield, anything that could have jerked your head forward and back, thereby jerking the pituitary on its stalk, could cause there to be pituitary hypofunction, or functioning that's lower than optimal. So you don't actually have overt pituitary failure, but over the years you notice that things just aren't what they were, and you seem to be aging or experiencing problems that you shouldn't be, or that your peers or friends are not. So human growth hormone is not this controversial substance. It is not a steroid. It is a amino acid sequence of 191 amino acids that your body has always produced, and at one point produced a lot of it when you were growing. It should be called the restorative and rejuvenation hormone. And done correctly, and done medically supervised, and done appropriately, and that is for the treatment of adult growth hormone deficiency syndrome, which is basically testing your levels, seeing where you are, if need be, getting a stimulation test, that basically we can assess exactly where you are and put that into context with your other hormones, and also assess if you'd be a candidate for using a secretagogue, which could help increase your own growth hormone, and thereby really maximize the benefits of this hormone replacement in terms of what it can do for your body. Now, I think that's something to be really clear about, is that a lot of doctors out there, they don't understand the important role that human growth hormone has in the body. I mean, in Europe, they use it as a therapy for congestive heart failure. There's some studies from the Journal of Clinical Endocrinology and Metabolism, 1999, of growth hormone replacement in adults who are deficient, actually reducing the thickness of the carotid artery and reversing cardiovascular age. So there are some studies that show that growth hormone has a beneficial effect on body composition, on strength, on cardiovascular risk, and things like that. Now, the big question about growth hormone and cancer. Well, there's actually been no studies that correlate the use of growth hormone to cancer. There's some evidence that people with acromegaly, and these are like the people who are giants, who have a pituitary tumor or who secrete too much growth hormone, their levels usually run above 1,000 to 2,000. And then they have an increased incidence of colon cancer, but nobody has been able to correlate that with human growth hormone. And obviously what we're talking about is running levels much lower. And in fact, as we were talking, for a 40-year-old, 50-year-old person, we're looking at levels of 200, 225, which is below even the high level for that age group. At least in my practice, that's how I like to do it, because for me, less is better. You'll hear me saying that a lot. Less is better. So if we can get away with less medicine, less interventions, that's always better, and let nature do its own part. A lot of times what I like to do with patients is mix and match. We'll use some human growth hormone for replacement for a couple of months, 3 months, to get an effect. And then we'll come on board with the secretagogue and get their own growth hormone going. The other trick that I like to use is the dosing of the growth hormone. I have my patients take it in the morning. That way you don't step on your own production at night. So the molecule of growth hormone only lasts a few minutes at the very most. So when you secrete it in the evening, at nighttime, 2 a.m., 3 a.m., when you're in deep sleep, it's already gone by the morning when I would have you dosing it anyway. So what I like to do is a combination approach that supports the endocrine system, because it's all about the endocrine system. And human growth hormone is a miraculous molecule for people who need it. For people who need it, it has been life-saving. It has gotten them out of beds. It has gotten them out of their just being lethargic and sitting on the couch. It has replaced the need for antidepressant medications. It has replaced the need for diabetic medications, because their whole body changes. And once again, this is if you need it. So as part of your normal workout, all we have to do is measure and see, are you low, are you not low? What we then do is I like to see, well, let's try using a secretagogue and getting it up naturally first. If we can't get it up naturally first, then we move to the bigger guns. But we do have those guns, and it's something that you shouldn't ignore. It's something that at least you should know the number and be able to have a conversation about intelligently, and not really go by just what the media is saying, because what they're putting out there is just not true, because you could take a whole vial of the growth hormone and have zero effect. And that's where the media is going wrong. It's just, in people's mind, they think that it's a steroid, like these artificially legal steroids, and it's not. It's just an amino acid peptide, 191 amino acids that your body has secreted since you were conceived, or shortly thereafter, once the pituitary was formed, and especially as you were growing as a child. You still are producing it. Some of you not at levels where it's therapeutic or optimal. It's those people that we need to really address, look at, but it's certainly something that you could ask for when you have your blood drawn at your next physical. The marker is called IGF-1, or insulin-like growth factor 1, and basically that will tell you what your growth hormone level is. If you have any questions, give us a call at the clinic. Have a great day. Yeah. Welcome. I'd like to present a short course on HCG therapy for weight loss, known as the Simeon Protocol. Dr. Simeons was a British physician who employed the use of HCG, which is human choreographic gonadotrophin, for weight loss. He's been doing it, and has been done, for approximately the last 50 to 60 years. It's been done all over the world and has a incredible safe track record. Now, let me explain to you how it works. HCG is a bioidentical hormone. It's the hormone of pregnancy. So basically, if I was to ask you the question, if you were to get pregnant right now, and I was to put you on a special diet and gave you some vitamins and said, okay, the baby's going to be fine, don't worry about the baby, but you're going to go on a special diet that has no fat, what do you think would happen? Well, most of you are thinking to yourself, well, the body would take all my fat to feed the baby. And that's exactly what happens. Is that the HCG basically gives your brain a scent for your fat. And then when you go on to a special diet that I'm going to tell you about in a minute, your body goes gangbusters after the fat, and you lose approximately 20 pounds in a 3-week period. There is a protocol where you can go longer, and I've had people lose 30, 35 pounds in a 40-day period. But generally, the 3-week period works for everybody well, and you can lose between 20 and, say, 25 pounds in that period. Now, how does it work? Well, basically, it starts out in that you give yourself a shot, which I show you how to do in the office. It uses a very, very, very tiny needle. So most people coming in, once I show it to them, even when they are nervous and they don't like needles, they go, oh, that was nothing. So you give yourself a shot every day for 23 days. For the first 3 days, or 2 to 3 days, depending on how long you've had the wait, you basically are eating as much fat as you can. So I know that sounds funny, but for the first 3 days, you're binge eating. Now, I basically tell the patients, don't eat a lot of carbs. You can, though. But what I'd like you to eat is things like organic sour cream, butter, eggs, fat. Because the idea is to put the fat high in your blood, so that when you go to the diet, which is basically just a low-fat diet for the 20 days that are remaining, what happens is your body is going to go and burn up all your fat. And that's the strategy here, because what's happened is the fat that you're holding on to right now And for those of you who are watching this, I'm sure many have tried different diets, from Weight Watchers to Jenny Craig to Atkins. I mean, you're diet experts out there. And that's what happens when people are coming in. You guys are just diet experts. Everybody is. But what the HCG does is it makes your body see the fat, because you all know when you've lost weight before, a lot of times you lose muscle, you lose the weight, and then what happens, you go back to eating normal and you gain it back, and then some like gangbusters, and that's the problem. Well, with the HCG, what's happening is it's forcing your body to burn up the abnormal fat. So that's why the book that I have for download at the bottom of this page actually is called Pounds and Inches, because not only do you lose pounds, but you lose inches. You actually lose inches on your legs, on your arms, on your waist, in places that you couldn't believe. The skin stays toned. You don't get flabby. It's really a miracle therapy, and I'm making this video because I've answered a lot of questions for people, and I have so many people who are thrilled with the results of this therapy, and have had absolutely no complications or problems with patients doing it. In other words, they tolerate it, they're able to do it. Most people say, oh, I don't even feel like eating, because what happens is the HCG is actually helping your body not feel hungry. That's the way that it's working. So you are doing a low-calorie diet, but you're actually not bothered by it. So it's real simple. I have a cookbook that I can supply you with that has wonderful recipes that actually we're using at home now just on a normal basis because the recipes are so good. I show you how to do everything that's related to it. Basically, to get going is as simple as getting some basic blood work to make sure that you're in a healthy state. And then us having a physical exam and just moving forward and getting you on the program. So HCG can be a real powerful tool for weight loss that you can utilize to really help shift your body. For many of the people in my practice, it's been a miracle because, as you can imagine, I'm dealing with a lot of weight loss, and it's really been a tool that has helped a lot of people. Now, I must say, I usually use it in people who have tried, who are really working hard, who are really trying to eat well, and they really have come up against a wall. And for those people, it's been miraculous. I tend not to want to use it for people who are still eating poorly, still haven't maintained the discipline of really trying to lose the weight, period. But generally, most of you who are going to be viewing this are working hard, are interested, are looking how to better yourself. And as far as I can see, this HCG, and I've done it on a lot of people, has really been something miraculous. And if you have any questions, you can give us a ring at the clinic. I'll be happy to talk to you, answer any further questions you may have. I hope that this was useful to you, and I look forward to seeing you. Have a great day.